Okay.
Hey,
Hi.
everybody, we're back today and decided we wanted to talk about some of the differences between mental health and family therapy, also called systems therapy, and just kind of clarify why it's different and why it can be more effective than typical mental health treatment, such as therapy with a licensed professional counselor um, versus an LPC versus an LMFT, a licensed marriage and family therapist. So we thought we'd discuss some different ways that family therapy looks and how that plays out um, and contributes to mental health struggles for individuals. So what are your thoughts about the differences between the two, Jen?
So I have an office that I sublease, and in my office I have a couple of LPCs. And every time I talk to them, I was doing supervision with one of them, and I was talking to her about bringing the family in separately to like see what their aspect was. And she's like, "We were taught we can't do that. That's a conflict of interest." And I'm like, "No, when we're in grad school, we're taught that everything works in a system. If there's a kink in one part of the system, and everything else ends up being like there ends up being a problem in the whole system." So I had a hard time breaking her of the habit that you can't see family members. She's like, "That's against my ethics. It's against the law." I'm like, "No, it is not."
Yeah,
So I've had to do a lot of training with them to break them. And they're very young too. They're all like in their early 20s, just freshly
hmm,
out of grad school. So I had to break them of that mindset that you can't work with the family. I mean, you get the
yeah,
best results when you work with the family.
yeah,
I may not do, I often do my marriage and family therapy. Like when I do family therapy, I will work with the individual separately before I bring them together.
yeah,
When I do couples counseling, I will work with them separately until they work on their stuff to bring them together.
yeah.
Because there's no point in bringing people together if all they're going to do is, they're all thinking the same way, they're all conditioned the same way. And oftentimes our generational trauma gets passed down
Yeah,
and that becomes their truth, and I have to work with each one of them separately to like have them understand that
yeah,
there are other ways of thinking, there's other ways of doing things. Just because your family does it that way doesn't
right,
mean that it's done that way, that then there's
right.
other ways to do it.
Yeah. And ethically without training. So that's great that you're doing that supervision to give them that training because ethically without that training, they're not allowed to do family therapy. But, as you and I are trained, I would rather work with a whole family than with one person. When I work with one person, I'm just given whatever bullshit story they tell me. And
Right.
I might need to have collateral information where somebody says, it doesn't really look like that, or that's not really what other people see. And so you get to some middle ground in relationships so that relationships improve. I always, I, um, I use the analogy of if you go to the doctor and um, you have a cough, that might be the loudest symptom. So you give them some cough syrup, but you might not be treating the problem, which is, bacterial pneumonia. They might need an antibiotic. And, relationship problems are exactly that way. For instance, a lot of times people grow up in a family where people yell all the time, and so that becomes their normal. Well, then they leave that family and get married to somebody whose family was, didn't really talk about problems, and they swept things under the rug. And those two come together, and in our society we kind of look at the loudest person as the problem. You're yelling all the time. Well, silence speaks volumes as well. And
It does.
so, you know, these two people come together with their own sense of normal. And if we just treat the loudest person as the problem, it ignores the lack of accountability for the silent partner in the relationship. So I really focus on integrating their realities so that, get one person to bring it down, but can't not talk about problems. There has to be an integration into people's realities. So that that family system changes the pattern. I think with typical mental health, we're taught to see ourselves as the common denominator in all of our problems as well. But really, the common denominator in a relationship is the patterns that exist between two people. And
Yes.
when two people contribute to the problem, then two people contribute to the solution. It's going to work more rapidly to get to some integrated model that works between two people without one person being the problem. So we don't just medicate the loudest symptom, we treat the whole system.
Well, and oftentimes the loudest person is the one trying to break the cycle. They're the ones going
Yes.
against what's going on. And
Yes.
oftentimes what happens is I tell parents all the time, when one person calms down, somebody else will step up and like now become the loudest person until we
Yes.
fix what's going on, at the head
Absolutely.
of the household there. We have to be able
Yeah.
to look at, how it's affecting everyone. And although you have one person now that's the loudest and that's screaming and kicking and doing all the stuff, and when that person calms down, if things don't get fixed, then the next person's going to pick it up.
Yes.
Yeah.
Yeah, that's the what do they call it? The
Symptom
um
bearers.
yeah, the symptom bearer. And it serves the purpose of main there's the function for the dysfunction. That's what I was thinking.
Yes.
The function for that speaker, the person that speaks the loudest, is to try to create problem solving in the relationship. For instance, in a family system, you might have mom and dad that fight all the time, and then you have one of the kids that's in trouble all the time. But when you look at the entire system, a lot of times what you see is that kid becomes a problem and serves the purpose of getting the parents not to fight. So he's really trying to save the parents from fighting all the time, which is saving the family.
Yes.
And is it intentional? No, not at all. It's not cognitive at all. It's just that patterns exist in the family and we tend to fall into those patterns automatically. So if you just treat that kid, we may be ignoring that there's another problem that risks the entire family. And I see this, I would say 95% of the time when somebody brings a problematic kid in to see me, his behavior is serving the purpose of
Yes.
trying to save the family. So 95% of the time, I have to go to the parents and help them change their patterns of behavior with each other so that his behavior or her behavior becomes unnecessary. It's not fixing the problem anymore. It's not saving the family because the family is improved because everybody's working on their contribution to the problem, turning
Yeah.
towards the center.
Well, and it's not only behavior, it's also sickness, right? When we are in a
Yes.
constant state of fight, flight, or freeze, living in a family where, it's not always the loudness, right? It's the silence, it's the other things too. Walking on eggshells, all those things. We're living in a constant state of fight, flight, or freeze.
Yeah.
So what happens is when we don't get enough oxygen to our brain and to our digestive system when we're in fight, flight, or freeze, we end up with constipation, diarrhea, stomach aches, just this constant feeling of sickness.
Yes.
So oftentimes when I have people come to me saying my child is always sick, I bring the family members in, like, what is going on in your household?
Yes.
Yeah.
Well, I often tell a story about how in my family growing up, people got more love by being sick. And I noticed when I was a kid that, the majority of the people in my family that I lived with all the time were women, and they tended to complain about everything: depression, anxiety, menstrual cramps, backaches, knee pain. So somebody always had some physical ailment or emotional ailment. And I didn't understand that because I wasn't really like that. And I'll explain what I learned about it later. But probably, I don't know, probably 10 years ago, I'd be irritated with my mom because I would say, I love you. She wouldn't say it back, whether I was texting or on the phone. And I know my mom loved me, but I would get irritated because she wouldn't say it. But one day I was leaving work early because I had a headache. And like I said, I wasn't really sick very often. And I was texting with my mom and I said, I'm leaving work early because I have a headache. And she said, I'm so sorry to hear that. Let me know how you're doing. I love you. And I'm like, what the fuck? And I was like, I wonder if it's because I'm sick. And so 2 weeks later, I lied to her and I said the same thing again. And she did the same thing. And that's when I realized that pattern that existed in my family, that we did get more love when we were sick. And, but at the same time, I realized I was also keeping my mom sick because I gave her more love than when she was sick than when she was well. I would drop everything, go stay with her in the hospital, talk to the doctors, get her home, get her settled. And then I'd be like, okay, now I have a break. And I would distance myself from her because it would be so draining. Well, once I realized how I treated my mom when she was sick, I decided I probably couldn't say to my mom that this pattern exists because oftentimes my mom was defensive and in denial, whatever anybody wants to call it. But if I were to say to her, hey, there's this pattern that exists, likely my mom would say, I don't make myself sick. So, and I didn't want to have a conflict with her. So I just decided I'm going to change my contribution to that pattern. So the next time she called me and said she was sick, I said, I'm sorry to hear that, Mom. I love you. I got to go. And the core of my being was like, you are the biggest asshole right now because that pattern was so ingrained in my family. And, but the interesting thing is I think I was about 7 years old the first time my mom was in the hospital for a heart attack or heart issue. And she had been in the hospital probably about once a year my whole entire life. And so this had been, about 40 years when I recognized this pattern. But the day that she called me after this and said that she wasn't feeling good, I said, I'm sorry to hear that, Mom. I love you. I got to go. She didn't go to the hospital. And she wasn't in the hospital for about 5 more years. She's since passed. Today is her birthday. Would have been
Oh,
her birthday. Yeah. But um, she would, I didn't want to just cut off from her. So what I did is I waited until she's sharing puppy pictures on Facebook and I made sure to reach out to her when she was well. So I connected more with her when she was well, but if she started to struggle, I pulled away. And it was really with the attempt to try to change that pattern that exists. And I believe that it made a dramatic improvement. Um, Now I can also look at why didn't I get sick? Well, my mom's mom, my grandma and I, we just didn't ever get along. And I remember I was about 4 or 5 years old and I had an ear infection and I threw up in the entryway of her house. And my grandma was so mad at me. And just from that experience, my brain learned there's no value in getting sick, right? My mom didn't make herself sick. She got more love by being sick. I didn't get more love by being sick. I
you got
felt
punished.
isolated. Yeah. So my body and my brain learned how to respond to my environment. It's the same as, if I'm training a rat to push a lever every 5 minutes, I don't have control over the rat. I have control over my response to the rat.
Exactly.
And I don't teach the rat how to tell time. This isn't about meaning, it's about a predictable pattern that exists. And when you change that pattern to responding every 4 minutes, you can change a pattern that exists in that relationship. So when I changed my response, I had a different interaction with my mom. And so when we understand how those patterns exist without meaning, without reason, without explanation, we start to see how automatic those things are. And it gets rid of this idea that people are intentionally working against us instead of working for themselves and according to these patterns that exist. And everybody gets to change it. Everybody has some contribution to the improvement of the health of a whole family system, which benefits every person in the system.
Yes. Well, you look at our culture, right? If you live in a family where there's high criticism, high judgment, they're just mean, critical, all those things, right? And you become a people pleaser. So what
Yep.
happens is there's no opportunity to be sad. There's no opportunity to take a rest. You
Yeah.
have to be on your toes and always
Yep.
be um, you know, the highest achiever. So oftentimes the only time in those families where people are softer are when you're sick.
Yeah.
So we are rewarded very early, by the fact that if you're sick, you actually get nice words, you get
Yep.
comfort, you
Yeah.
get people actually slowing down and caring about you.
Yeah.
Now, you at a young age were conditioned by your grandmother, what did you learn? Throwing up got you punished.
Yeah. Yeah. Don't get sick.
Yeah. In our
Exactly.
society, in our culture, in our society, we really don't have time for depression, sickness, or anything else. So,
Right.
well, depression, anger, grief, all those things, it scares people. But for
Yeah.
some reason, sickness, people are a little bit more compassionate with.
Right. Yeah.
Yeah.
Well, and people pleasing, that really gets conditioned in family environments as well. I would say 50% of my clients who have anxiety, probably 80, if I'm guessing, I would say 80% of the people in my office that have anxiety are people pleasers. And
Yeah.
their job is to make everybody else around them comfortable, which teaches people to expect that person will make me comfortable. But I also say that robs them of the opportunity to learn to manage their own discomfort. So all the discomfort has to stay here with you. And learning to say no, learning how to let other people be uncomfortable while you're managing your discomfort with that, it becomes easier to establish healthier patterns that don't work at the detriment of yourself. So saying yes to everybody teaches them you'll say yes. You
Yes.
you don't give somebody everything and all of a sudden they want less. Their dopamine is like, yes, give me more, give me more. A rat does the same thing. Feed the rat, it
Yes.
pushes a lever. And so learning to understand relationships as a system removes this idea that I'm the common denominator in all of my problems. I contribute to a problem. So I'm going to change my contribution because that's all I can change. And it gives them something they can do so that those patterns can't exist. A pattern in a relationship is sustained by two people, but it can be changed by one.
When I was in grad school, this was the coolest thing that we did. I remember our professor came in and he's like, we're going to have a TA coming in a couple, like in like a week or two. And he's like, we're going to do a little experiment to show you how easy it is to condition people in a system. He's like, so I'm going to have one of you, when he comes in, look the other direction and don't stare at him. He's like, you'll see, it's not going to bother him. He'll look at you, looking, wonder why you're looking over there, but it's not going to really make a difference in how he teaches. Now, as the weeks go by, slowly, all of you are going to look over in the other corner and you're going to train him to now teach from that corner.
Oh,
So,
cool.
so the system, as a system, we collectively taught him to slowly move to that corner because
Yeah.
one by one, we all started turning our chairs and our focus to the other corner and away from
Yeah.
him.
Yeah.
So when one of us did it, it wasn't a big deal. But when all of us started doing it, he started becoming very self-conscious. He started adjusting his behavior.
Yeah.
He started losing his confidence. And we
Yeah.
slowly, by the end of the semester, got him to be teaching from the other corner, which to
Right.
me was fascinating how easy it was in 3 months to be able to change someone's behavior.
Yeah. Well, and you see that in a lot of social psychology experiments, right? Where let's say you have a waiting room and, there's 10 people in there and five just stand up for no reason. You get people looking and people standing to join, trying to figure out why everyone is standing. And it's because we have this social brain, this prefrontal cortex that as it develops, we're in this constant negotiation between maintaining the value of the people in our lives and the value of ourselves. So we need that social brain. Humans are herd animals. And when
Yes.
we don't have our herd, our stress chemicals rise. adrenaline and cortisol, and we tend to be more in fight, flight, freeze when we're isolated from our herd. And, we start to
Or if
feel
we stand out from
lonely.
our herd, if we're doing something different, right? If
Yes,
everyone's standing and you're sitting, it makes you really question yourself. So now take
oftentimes,
that
yeah,
over into the family system. And what happens is that
yeah,
you learn really quickly that if I don't conform to what they're doing, even though I know deep down
yeah,
that it doesn't feel right, it doesn't look right. But as
yeah,
kids, we never look at our parents and think, what's wrong with that? We look at
yeah,
ourselves and think, I must be wrong. My
yeah,
judgment must be off. My gut must be off.
yes,
So we
yeah,
end up adjusting our behavior, even though we know deep down that something's wrong with us.
mm-hmm,
And we end up just kind of adjusting it to be able to survive in that situation.
mm-hmm. Without
And
that
then what
pressure,
happens is
yeah,
we go into adulthood and we use the same coping skills and the same systemic rules that we learned and we apply them into adulthood, they no longer work. And we end up
yes,
feeling like we're a zombie. We end up feeling very disconnected from others. We
yeah,
end up feeling we're on the outside looking in.
yep. We're all normal within the context of our own lives. Our experiences are what wire our brains. 3-year-olds have more neurons in their brain than they'll ever have in their lives. So the majority of our wiring is created when we're kids. So we get this idea of normal, but then you leave that environment, and pretty soon those things might be your normal, but they're not effective because now you're interacting with somebody else who has a different set of normal, and you have to figure out what works between two people, right? Maintaining both people's value. And I think, we have social norms, but I think that the best way to look at it is sometimes social norms are designed by the person that applies the greatest amount of pressure on other people in the system because they aren't doing as well at managing their discomfort with accepting influence from other people's sense of normal. So
Yes.
we have 8 billion people on the planet. Everybody's brain has about 100 trillion different experiences in there because we have about 100 trillion synaptic connections where our memories are stored as electrochemical signals. So 8 billion people on the planet, 100 trillion different experiences stored in their brain. The mathematical likelihood that any two could be the same is zero. But we have this idea of one normal that is not effective for 8 billion people. So you have to be able to accept influence from one another and not be married to your own idea of normal so that we maintain the herd, which ensures the survival, different from being isolated.
Yeah. I have to laugh because growing up, I had a friend all through high school and college. I had this friend, every time she would bake, she would put a pan with water, like a baking pan with water in the oven. And forever I kept asking her, I'm like, why do you keep putting this pan of water? She's like, you just need that to bake. And I'm like, I never learned that. I'm like, and it made me question myself. I'm like,
Right.
and I was looking it
Am I
up and I'm
doing it
like,
wrong?
am I doing this wrong? I'm like, I never got that learning. I apparently that maybe I'm wrong. So I started putting the pan of water in there and I saw no difference. So one day we were at her mom's for holidays and I had asked her mom, I said, I have a question for you. She said that you baked with a pan of water in your oven. Why is that? And she's like, oh, well, because I inherited my mom's oven and my mom's oven was broken. So it leaned. In order for it to bake evenly, she had to put a pan of water in there to make the oven balance.
That's
So,
funny. I
but
think
no
you
one ever
told me
told
that story
her.
before. Yeah.
Yeah, no one ever told her that what was happening. So she just assumed that that's how you
It's
baked.
required. Yeah.
Yeah, and for me, it made me question everything I ever knew about baking. I'm like, I even took home ec in high school, and I'm
Right.
like, they never taught us that.
Yeah.
So then it made me
Well,
question everything I ever knew about what I was taught.
yeah. Well, and I think this is where I like the crossroad between psychology and family systems because, understanding psychology, you understand, conditioning that, so for instance, people are conditioned to respond according to their environment. And we both have kids and we know kids create chaos in our lives. So we're like, your grades are bad, fix them. Your room is a disaster, clean it up. I don't like your attitude, straighten up. And really what we're saying is, I have a problem, it's your job to fix it. I have a problem, it's your job to fix it. I have a problem, it's your job to fix it. So, and it's they don't know things about how the world works, so we're teaching them. But the unfortunate conditioning, the unfortunate side effect of that learning is they learn they're the problem in all situations, right?
Yes.
So
Mhm.
unintended, but then they go off into a relationship and the wife says, I could use some help with the dishes more often. And he says, I just did that. Right. So he immediately starts looking at how he contributed to the problem instead of understand why that's a problem for her.
She's just
So
making a statement. She's making no
yes,
judgment. She's just saying,
yes,
I need help. And
yes,
automatically, what happens is that judgment that we ended up with as children
yeah,
now becomes our inner theme song and that voice that
yeah,
drives us.
yeah. So
Yeah.
you get a lot of relationships where this criticism or perceived criticism and defensiveness instead of understanding why is that a problem for you. A lot of kids, if they were to say, why is that a problem for you? A lot of times kids are like, they hear, I'm going to show you why it's a problem for me. Just get it done. Right. Because there's a lot of chaos. So it's generally unintended for that you know constant lens on yourself for it to be there. But when you understand that automatic conditioning, unintended conditioning that creates that wiring that says, I need to defend, I need to fight back, I need to speak up, or I need to shut
I need to
up.
be a porcupine and have my quills out. So I'm always
Yes,
protecting myself.
exactly.
Yep.
Yeah. So
Well, and you
then,
figure going back to your comment about being three, right? The 3-year-olds have more neurons in their brain than they'll ever have, right?
yeah,
They get to puberty and those neurons that haven't been used get killed off, right? They're like
yep,
fully being clipped. So
yep,
then all of a sudden, we don't, our prefrontal cortex isn't fully developed till about 25 years old. So all
yeah,
that between 3 and 25, we're still learning. Our
yeah,
neurons are still developing, and I have preschool teacher friends that will always say, it's okay to make a mistake. You're just learning. You don't have, your brain's not fully developed. And she
right.
tries to instill that in the parents. Let them make mistakes. When they
Yes,
ask why, it's not because they're trying to be annoying. It's because they want to know why things work.
yes.
They're not
And
trying to test your patience. They're
yeah,
trying to actually understand their world and why
yeah.
you're asking to do that.
And the majority of our work with our clients is to help them learn a different way of looking at a situation so that they go, oh, okay, that feels better than what I was doing. And they choose a different response. They learn how to have a different response, whether emotionally or behaviorally. And they go, oh, okay, I got some dopamine from that. And they create new wiring in their brain that becomes automatic. And it's not white knuckling and using willpower. It's interacting differently emotionally with your experiences so you can do things differently. But that
Yep.
whole system does play a role and should be considered,
Yeah.
whether
Well,
whether somebody's there or not. That's why when I'm working with an individual, I still always ask, what are the things mom said? What are the things dad said? Because most people come in and say, I had a normal upbringing. Everybody
everybody
has
says
their own
that.
normal. Yeah.
No one ever
Yeah.
come in and says,
Yeah.
hey, guess what? I've been
Yeah.
questioning the things that I'm realizing. I have so
Right.
many people who come in that are like, oh yeah, everything was normal. And you find out there was heavy drinking, or there was lots of
Yeah.
criticism, or, mom was depressed, or dad was like never there.
Yeah.
And it's like those things, that chronic toxic stress really has an impact on our self-esteem and those inner theme songs that we walk around with. And
Yeah.
normally those inner theme songs end up being, I'm not good enough, I'm not lovable, I'm inherently defective,
Right.
I'm powerless, I'm helpless.
Yeah.
Yep.
Everyone is normal within the context of their own lives, but
Yep.
normal isn't always effective. So the goal in family therapy is not to be more normal. The goal is to be more effective.
When I have older families come in, like with kids that are in their 20s and their parents, or when I have couples come in, I always ask, when you get around this person, how old do you feel emotionally? Because what happens is the minute that dynamic comes back and that inner theme song is triggered, all of a sudden now we become 7 years old, eight
Yeah.
years old. And what
Yeah.
do? We respond like we're 7 or 8. We always go into fight, flight, or freeze.
Yep. Yeah.
And I tell people, all the time that lying in the system of growing up, lying becomes very functional when you're growing up with people that you can't trust to have a consistent answer over time or a consistent response. If
Mm-hmm.
you're afraid one day they're going to be like, oh, it's great, but the next day they're going to freak the fuck out. What's going
Mm-hmm.
to happen? You're going to learn as a kid that I have to like tread lightly and
Yeah.
now fish to see what I can share with this
Yeah.
person.
Yeah, when you can't trust somebody's words, you learn to trust their behavior, and that's what becomes
Exactly.
predictable. Yep,
Yeah. So what happens
absolutely.
now is you go into adulthood and you get married, and all of a sudden, you are still acting in those certain ways that you acted as a child, which then brings out the other person's trauma. And what
Yep.
happens is now you're
Yeah.
both functioning like you're like teenagers or middle school or elementary
Yeah.
school, and you're in this gridlock of conflict that you can't get out because you really feel powerless, helpless, and like you're 8 years old, like
Yep.
you have no voice, you have no say, you have no option.
Yeah.
So I always tell people, I'm like, the art of the pause. I want you to stop when someone's talking to you and ask yourself, how old do I feel right now? Who does this
Mm-hmm.
person remind me of? What kind of situations was going on around this age? Then all of a sudden you're shutting down, or you're
Mm-hmm.
lying, or you're getting defensive.
Mm-hmm.
And
Yeah.
most people say, yeah, I feel like I'm 8 years old. And it reminds me of being scolded over something that wasn't important,
Yeah.
that
And
wasn't that big of a deal.
yeah, in similar situations, I'll try to change that pattern and say, what's your typical response in that environment? And let's explore some different options. I got a fruit fly in here. Bitch is gonna die.
Kill that
Take
bitch.
that as your warning, fruit fly.
Get one
Uh,
warning in this house, and then you're
that's
dead.
right, exactly. I talk to all the bugs that are in here. I give them one warning to get out.
But you did not raise your kids like that.
No,
Disclaimer.
no, God, that would have been easier for me, but way worse for them.
Right? Every time
Yeah.
I got near my mom, she slapped me.
I had to manage my discomfort. Yeah. So, um, but in that situation, I may say, because you don't have control over another person, you only have control over your response to another person. And so I always look at what's the pattern of their response. So kind of the same thing. I respond like I'm 10, or I respond by yelling or whatever it is. And the goal is to explore the emotional feeling of doing something different, whether it's walking away or, somebody, I use the example, if somebody calls me a cunt, doesn't mean I'm a cunt. It means they think I'm a cunt. Just like if they said I don't like spinach, doesn't mean anything about me.
Right.
And so I, one of the things I may do is if somebody calls me a cunt, I may say, what would you like to be different? And it's just responding without throwing a fit and putting the questioning back on them, giving them the opportunity to explain what they want to be different. And it becomes difficult for them to continue screaming at somebody who's being open to looking at it a different way, knowing I don't learn anything about myself from somebody else. I learn their perspective about me. It
Yeah.
doesn't make
Well,
it
you have to
any
look at that theory of extinction too, right? When you're now trying to do a whole new behavior, what happens is people are going to keep pushing and pushing and pushing
Yep.
until they get a response from you. And then what
Yes.
happens? If you wait, if they got you a response here before, and now all of a sudden you're responding up here, what's happening is the next time they interact with you, they're going to start up here.
Right.
So it's that
Yeah.
now it's managing your ability to, like, when you're doing something different, I call it the emotional hangover, is that you feel guilty, you feel bad, you feel like, I'm letting them down. You're feeling like, oh my God, I'm like abandoning them. So we
Mhm.
have to control our own emotional hangover in order to do something different.
Yeah. I think we might have touched on that last time. If you have a toddler and every day at 5 o'clock you give them a cookie, and then one day you decide you're not going to do that again, what's the toddler going to do? A 2-year-old is going to throw a fit. And the purpose of that behavior is to get you to fall back into line with their expectations.
Yep.
So there's the pattern that exists. And even a toddler can learn a pattern. But
Oh
when
my
an
God, they're
adult,
brilliant when it comes to being
yes,
able to condition the
right.
parents.
But we
Yeah.
wouldn't look at a toddler and say, you're manipulating me. We would understand, okay, I've conditioned this. But when an adult has big behavior, all of a sudden we say that person is intentionally trying to do XYZ instead of having accountability for our contribution to the pattern still.
Yeah.
Right.
But
So
you
we
think
apply
about
that
most of the
label.
parents who are parenting out there are emotionally stunted themselves from their own trauma or their own chronic toxic stress, right? So
Yep.
oftentimes they don't know what to do once a kid gets a certain age past where they're emotionally stunted, right? So
Yeah.
at that point now their kids have a lot more power and control and they
Yeah.
get away with a lot more things because the parents have no idea what when they're emotionally 8 what to do with a 12-year-old or how to deal
Exactly.
with a 12-year-old's emotion because
Yeah.
they're going to shut down everything that was shut down in themselves.
Yeah.
So
So
we
learning.
condition, yeah, we condition our animals, we condition our kids,
Yep.
we condition our partners,
Yeah.
all, subconsciously to do the things that we want them to do. And from an outsider's perspective, it looks manipulative, it looks narcissistic, right? It
Right.
looks like it's borderline personality.
Yeah.
But all those things served a purpose
Yeah.
to keep us
And I think
alive.
even giving it that label, it deflects from the reality that it's conditioning and a pattern that exists that we do have the ability to change rather than we all, because, most of the time when I see a couple, they both come in and they're like, that's the problem. That's the problem. But their accountability to the problem is the first step in being able to change this person's contribution and
Yes.
this person's contribution versus I'm trying to fix you, you're trying to fix me, and nothing happens because you can't fix them. You have to be willing to change yourself and have
And the
accountability.
amount of people who come in treating their spouse like the enemy, the enemy is the problem, not your spouse. You're supposed to be working together against the problem, not working, you are the problem against your spouse.
Yeah.
Yeah.
Well, and typical mental health treatment, oftentimes without understanding that entire system, a lot of times the first time a couple comes in, they're fighting on the way there. And a lot of therapists would say, let's keep talking about the problem. And I say, no, we're going to get the part of your brain working that you want to be working, the most effective problem solving part of your brain. So I'll stop them and I'll say, let's think of one of your happiest memories. And it doesn't have to be the same one. And, think about one of your happiest memories with the other person. And where do you feel that in your body? And what sounds did you hear? And what did you notice in the face of your partner? We'll do that for, maybe 2 or 3 minutes. And then I'll say, now repeat what you were saying in the car on the way here. And their brain is like, oh, I can't.
Well, when you orient people to the here and the now, right, that changes everything.
Yeah.
Because when you're using all those somatic, feelings, like what do you see, what do you hear, what do you feel, you can no longer live in the past or being worried about the future. You're right back.
This part of your brain doesn't tell you
now.
Right.
Yeah.
This part of your brain doesn't tell you to fight, flee, or freeze anything that isn't deadly.
Yes. And when you're back in the here and the now, the problems that we thought were a problem aren't often a problem.
Right. Yeah. When somebody's like, fuck you, and we say, okay, let's get your brain where you want to be when you have a conflict. And they get back to that memory of their wedding day or, a great vacation. And then I say, now try to say, fuck you. Even a lot of times mental health providers aren't going to say, try to be upset, try to get mad. But it works because then they get to experience, oh, I do have the ability to turn this off. But it's a matter of teaching them how to do it, not just expecting them to knock it off. You're not going to talk calculus with somebody who never took a calculus class. You're going to teach them calculus first.
Right, exactly. And I think that's the problem with LPCs too. I think a lot of times, no offense to my LPCs out there, I think a lot of the times they go for what the problem is. They don't look beyond what the problem is.
Right.
Now, there's a video out there and it's this lady with a nail in her head, right? And she's talking to her husband. Have you seen the video? And she's like, I just have this like ringing in my head and just this pain. And my sweaters are always like snagged. And the husband is like, it's the nail. And she's like, will you stop talking about the nail? And, it's like we have to go deeper than the nail. Yes, she's got this nail sticking out of her head. It's causing all those problems. But what is she getting at is she wants the husband to know that, yes, there's a nail there, but there's more than the nail. There's feelings, there's emotions, there's things that are underlying.
And most of the time in conflict, they're not even fighting about the same thing. A couple may fight about taking the trash out every single day. But one person, when you play out this conversation, you realize one's talking about the amount of time that it takes to get it done. And the other one's talking about the amount of money that it costs to empty another dumpster, put another trash bag in. And even further than that, it's not just about time or money. It's about, why is that important to you? Well, I don't want to be the type of mom that my mom was, because all she ever did was clean. She didn't spend any time with us. So I don't want to give up that time. Why is the money important? Because I grew up poor and I never want to be poor again. So they're having a fight about the trash every single day, but it's not about the trash at all. It's about time or money. And when you separate it, they start to clarify the money part of it and then the time part of it. And then they start making movement. Okay,
Well,
let's try
we attach
this.
meaning to all those things by
Yes.
our past.
Yep.
So it's like the meaning that we have when I say, take the trash out is I just want the trash out. But the
Right.
person that, does do the finances and that was grew up poor or, is trying to like figure out a way to do things different, their automatic thought isn't, well, the trash is piling up and we're playing trash can Jenga. They're looking at like, oh my God, if I take the trash out, we keep eating more of the groceries. Now we have the cost of the trash. And on top of that, our kids are growing and then college. So no longer are people in the moment, the here and the now, right? They're going off their past experience, what they viewed as finances, and then worrying about the future, how they're going to pay for the growing kids and the more food.
And what they're both doing is for themselves. It's not against the other person. The other person is not like, I hope you end up poor. The other person is just doing what their dopamine system has the greatest value for them and vice versa. But we interpret that intention as being against one another instead of really getting to listen to understand a problem before you try to solve it for each other. Because this is two separate problems. It's not one. It's time or money for different reasons, two different people's perspectives. And both, I tell every couple when they come in my office, you are both 100% correct at how you look at these problems, because the wiring in your brain said, this is how you do it. You're fully capable adults, but now the goal is to switch to understand a problem before you try to solve it your way. Try to understand and know you don't have to defend your perspective. Yours is already right. Now your job is to understand how theirs is also right, and then figure out how to integrate reality.
Yeah, what I do is when they come in, I'm like, let's look at the things that aren't working for you. What are your inner theme songs that are like running your life? The minute that your spouse asks you to do something, automatically, I've got no power and control comes up. And all of a sudden you want to fight back and push on every little thing. Or, what do you want to get rid of? And what do you want to bring forward? What are the new rules in your system? What didn't work growing up? What are the things that you wished would have been different? And when you communicate, what do you want from your partner? And I have people look around, I'm like, look at all like the things in nature. There's mountains, there's clouds, there's rain, there's grass. What kind of element do you want to be when dealing with this problem? Do you want to be a porcupine, or do you want to be like the grass? The grass that gets rained on and trampled on, but still can stand strong and be able to communicate and grow and flourish.
And that's absolutely about designing your life the way you'd like it to look moving forward, without carrying these identities that other people gave to us growing up. You're a brat, you're difficult, you're never going to succeed. Getting rid of those conditioned messages and starting to look at, how would you like life to look? When you start looking forward, this is the only thing that's possible. This doesn't even exist. And can you unbrush your teeth? No, we don't need to undo any of those things. We just have to design moving forward.
We can't squeeze toothpaste out of a toothpaste tube and then squeeze it back in. It's just not possible. We can take it, we can put it in a different container. We can use it. It's not bad. It's just no longer in the container.
And we don't need to unbrush our teeth or feel like I need to get rid of my guilt for what happened in the past. It's a moment that doesn't even exist anywhere in time or space. Nothing needs to be done about it. We get to design it forward.
Well, I ask people, I said, when you come across the problem now, what happens to you? Do you fall apart? Do you implode? Do you explode? What happens to you? And now let's look at, what do you need to get from here to there? And I have people, I'm like, respond. I'm like, look around at people like around you. Look at people from your past. Look at people from like movies or TVs, and someone that you looked at, they deal with anger well. What are they doing to deal with that anger well? And what do you need to do differently? How are you going to break that cycle?
Right.
All the
Yeah.
things that you learned. I mean, all it is just doing unlearning, right? We're unconditioning people and reconditioning them to
Mhm.
know that everything that you learned functioned growing up, but now it's no longer working.
Yeah.
And we have to break that cycle somewhere in order to get
Right.
different results. Because
Yeah.
the more that we do the same, what did that, it's insanity, right? The more we do the
Yeah.
same, it doesn't work.
Yeah.
Insane.
Yeah.
Yeah.
Exactly. So the goal is just to change something.
Yeah.
So,
And going back to your talking about sickness in the very beginning, right? Sickness
yeah.
is functional in broken families because oftentimes, if there's sadness, we're not allowed to be sad, right? Grief.
Yeah.
Who wants to be sad or who wants to grieve?
Yeah.
Nobody, right? And
Right.
we're a culture that is so like we're collective at the same time in a system, but also we're independent.
Yeah.
So people use their words, they use their actions to make you feel like your emotion is wrong, how you're
Yeah.
dealing with this is wrong.
Yeah.
So when we're sick, we do get that attention. We are learning that it's okay to be sick. So now Bessel van der Kolk had wrote that book, The Body Keeps Score.
Yeah.
And what does he talk about? Repressed emotion comes out somewhere. And
Yeah.
usually it comes out as
Yeah.
a chronic illness. It comes
Yeah.
out as sickness. It comes out somewhere in our
Yeah.
body. And
Oh, and
what happens?
when you
But
treat that trauma, I always see this breath. It's like that trauma leaving their body.
yes,
It's
yes.
it's palpable. You can see it
And I
when they
tell
get it.
people, yeah,
Change the
when I'm doing
wiring.
my trauma therapy with people, I'm like, okay, where do you feel it in your body? Most people, women especially, feel it from our throat down to our stomach.
Mm-hmm.
And I tell them, I'm like, okay, let's make it malleable. Let's make it like move. And then as
Mm-hmm.
soon as they can, like, after a couple of weeks, after a couple of months, however long it takes, I can physically see that trauma moving out and coming out.
Yeah.
And it's like that
Yeah.
change in their
You
body,
can
how
see
they
their
sit
feet
different.
stop tapping, their hands stop
Yes.
wiggling, fidgeting
Yeah, the
stops.
way they
Yeah.
sit just
Yeah.
change.
Yeah.
And I tell
But
people,
think about it, that trauma is adrenaline and cortisol telling your body to take an action to avoid something, but it's not a bear chasing you. If a bear's chasing you, you're using that adrenaline and cortisol. But when the trauma is a neural network that exists in your brain and that's it, but it activates that fight, flight, freeze response, yes, that's why we
yes.
stay agitated and upregulated on our
And
body.
living
It's
like we're at a
because
rave all the time.
yes,
Our
that's
body's
why
always like
people's
pumping.
cortisol rises. When cortisol
Yeah.
rises, so does adrenaline. They work together. One goes up, the other one goes up. One goes down, the other one goes down. So learning how to recognize that trauma in your body and take some action to teach your body how to respond more effectively also helps treat that trauma.
Yeah. What I started doing is taking a picture of people when they come in for the first session. And after we work on their trauma, I take a picture of them when they're done and their face just changes. They look
Oh, that's
younger.
cool. Yeah.
They
True.
look more relaxed. They just look happier.
That's awesome.
Yeah.
Never thought about that. I would love to do that.
Yeah. I mean, it's such the difference in their face alone and the way they sit,
Yes.
the way they carry themselves.
Yeah.
The way that they start changing the way they dress, the way they act.
Yes, in a family, you can see that they come in and they sit on opposite sides of the couch. And then at the end, they're sitting next to each other. They're making eye contact. It's a complete shift.
Yeah. And often when you have families too, the kids will be in between the parents, right?
Yep.
And when you start working on that system, what happens is now by the time they come in for the 10th session, the parents are sitting together and the kids are where they need to be.
And it's not something we ask them to do. It's something that automatically happens because the parents have removed the kids from being the mediators of their relationship.
Yes. And now, have you ever tried it in the beginning of a session when they first come in to have changed that dynamic? I'm like, I'm going to have you two sit next to each other. And the discomfort is so real. Yeah, when you ask the parents to sit so close to each other, they're like sitting next to each other, but they're turning away from each other. And then the kids will start doing things to get attention. So the parents are no longer focused on their discomfort. They're now like trying to be like, pick that up, do that, be quiet. It's crazy how when you mess with those dynamics just in the way they sit, you can see exactly what's going on. Yeah. In the
discomfort is palpable when you try to do that in the beginning, for sure.
Yeah. Good. So when I took my play therapy training with the great Carla Sharp out in Hawaii, she's amazing. She developed this thing called the build a house technique. And you sit down with the family and you use blocks to see how they interact with each other? Do they build a roof? And usually roofs mean secrets or sexual abuse, and you can watch the dynamic of the family building a house together and to see what's really going on, who's in charge, who's running the house, who has the power, and it's like,
Right.
as you ask them to do different tasks, can they work together? And most of the times in the beginning, they can't.
Yeah.
They're all building their own rooms. They're all doing their own thing. Or you often have the kid being the one that's like, Mom, Dad, no, this is how we're going to do it.
Mhm.
And then when
Yeah.
I say to the parents, I'm like, I want you guys to take charge. Most time the parents don't know how to take charge, and the
Yeah.
kid will throw a fit.
Yeah, we're just teaching them skills that they don't have. It doesn't mean that there's a deficit. It's just learning a skill for how to communicate effectively and how to work with everybody in the family having value to the system.
Exactly. And like I said, we learn the things, from childhood, and we keep them going because that's what we've learned.
Yeah.
Yeah.
That's
So the
our
other day
normal.
I was watching Lion King. They just re-released it into the movie theater for its like 30th or 40th anniversary.
Oh, yeah.
And the whole time in the movie, all I thought was, damn, if Mufasa just would have told Simba, hey, your uncle's manipulative, not trustworthy, stay away from him. Think
Mhm.
of how different that movie would have been
Oh,
and
yeah.
his life would have been,
Yeah.
right?
Yeah.
Mufasa still would have been
Instead of
alive.
keeping the family secret.
Right. So they kept the family secret, and it just tore their family apart. And it
Yeah.
tore the whole pride apart, right? The
Right.
whole like village was now torn apart. But we
Mhm.
are stick so closely to the way that things were done that when we do
Yes.
it differently, it feels awful. It
Yeah.
feels weird. It feels very, very foreign. It's like me
And
telling you, here, speak French to me when you've never picked up
yes,
a French book
exactly.
before.
Yeah.
Yeah.
And for kids who are less than, smaller than, don't have the freedom, don't have the control, don't have the skills, for a kid, they're just kind of drug along in this chaos between adults. And yeah, a lot of times managing the adult problem helps give the kid, the coping skills that they need because the chaos has changed.
Right.
So,
Yeah. So
but we
you look
carry
at
that
like,
chaos
yeah,
into
but you look
adulthood.
at the evolution of what we watch. Kid shows, TV shows, right? Back in the 50s and the 60s, the dads had their shit together, right? And it's like
Sure
there
they
was a
did.
nice system. Like they had their act together, right? They went to work,
Yeah.
they came home, they didn't show the woman behind the scenes drinking their martini at 2 o'clock in
Right.
the afternoon and getting electric shock therapy. But for the most part, it appeared to be like they had their shit together, right? Then we get into the 80s, and what do we start seeing? Homer Simpson, right? And the Married with Children, right? The decline of the American dad, and now the dysfunction in the family system.
Mhm.
And I look at the movie Crudes, right? If you think about the movie Crudes, that dad was just like Homer Simpson and all the other dads from the 80s and 90s, right? He was my way, me, 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 me. We're not doing this. Ah. And everyone in the system is saying, Dad, we have to move forward. We have to go. And he was so set in his ways and saying, no, we're not doing this. But the world is ending around them.
Right.
And if it wasn't for those family members saying, well, let's get out of here, he would have
Yeah.
stayed there, and it would have been the decline of his family.
Yeah.
But it's like we look at the movies and how they reflect what's really going on in our society and in the family unit.
Mhm. Well, and really, what is this discussion? This discussion has evolved into the system that exists societally, right?
Yes.
Back in the 50s, passive aggression was rampant because it was not appropriate to be assertive because it looked aggressive.
Yes.
Right. So you got passive aggressive. And the alternative is you be passive and go get your electric shock therapy. But,
Right.
Societally, that's what was the norm. And, as time went on, it became more okay for Homer Simpson to drink his beer and eat his donuts and, the wife to be like, versus, just cooking the dinner.
Well, and the kids being a mess too, right?
Yes.
Yeah. And then,
Yeah.
I mean, Lisa Simpson is the ultimate like people
Yeah.
pleaser, right? Like
Yeah.
she is the ultimate one. And, you look at Bart, you look at him and you think he's the problem, but who's really the problem?
Right. Well, and the difference is, Leave It to Beaver, the problems were not addressed, that everything was just glazed over. And then you have the Simpsons, the problem becomes more obvious, but it does make it a little bit easier to understand what the problem is so you can target the solution to the problem versus just act like nothing ever happens. Nobody talks about it. I say couples that don't fight are worse off than couples that do, because the
Oh yeah.
couples that do, even if they're fighting every day, they're at least talking about a problem to try to understand it, versus you don't talk about a problem and you tend to pull away and
Yeah.
distance from each other and feel isolated, and anxiety and depression increases and people just feel stuck. So
Well, if you look at too the women in those like Married with Children, The Simpsons, right? All the cartoons coming forward in the TV shows, right? Those women who were like now having a voice would have been defined as hysterical back in the 50s and the
yes,
60s. Take your
yes,
medicine, you're hysterical.
yeah.
You don't have a voice, shut up.
But they might have been able to go to the doctor and get a vibrator.
Right, exactly. You
Yeah,
just need to have an orgasm.
right. All the problems are solved. Yeah. Yeah. So
We're gonna give you like electric shock therapy, or we're gonna like give you an orgasm. You choose.
right. No, I'll take the vibrator.
Right.
Yeah. So there's been this huge evolution, and mental health historically doesn't look very pretty. I think the state of mental health moving, where we are now is good, because now we can at least talk about it and connect with some herd members. But I think marriage and family therapy, systems therapy still needs to continue to evolve so that the problems are addressed systemically, not just individually, as if there's one problem in a relationship. And
Yes.
100% of the people that I see, their problems are relationship based. So I
Yes.
always address it.
Well, all those attachment wounds, right? All those
Yeah.
attachment wounds that we've experienced from such a young age follow us. You know, our formative years is, 0 to 7, right? Those things stick with us for such a long time. I mean, childhood is this small of a time, but we spend the rest of our lives trying to get over that small period of time.
There's nobody that makes it out of childhood without baggage. It's still our jobs to unpack it so that it doesn't become somebody else's baggage. And in a relationship, learning to understand each other's baggage so that you hold your partner accountable for unpacking it versus you requiring yourself to carry it, or they require you to carry it.
Yeah. Well, the thing is, if you don't even know you're hurt, you don't even realize that you're hurting other people. When your childhood has been so right, when it's been so normalized and so conditioned that this is the way things are done, we go off into adulthood and we want to blame the partner. Well, he doesn't listen, she doesn't do this. It's the kid's problem, right? It's everyone else's
person
problem.
Didn't grow up in your norm.
Exactly. Yep. Somebody asked on Reddit the other day, what are some things that you grew up thinking were normal and you didn't realize until adulthood that weren't normal? And I just love the responses, there's like thousands of them. But one of them for me was I was given alcohol and drugs at an early age by my aunts and uncles. It was a thing. I mean, I grew up in Wisconsin, so alcohol is a very normal thing in Wisconsin. But from the age of 12 on, I had uncles that were growing weed and they're like giving it to me like it was no big deal. And when I went to therapy in my 20s, my therapist says, that's not a normal thing, right? I'm like, it's not. It blew my mind that people weren't given. I mean, I would never do it. I would never give a child alcohol or drugs. But for some reason, I'm like, well, that was just normal. That was just the way things were done. That was just the 80s. But no, it was just my family was really fucked up.
Yeah, my family was all about guilt. And, there was no way away from it until I learned guilt doesn't make me a better person. It makes me a better person for everybody else, which can be at my own detriment. So learning how to remove guilt and knowing not having guilt doesn't make me a sociopath. Not having guilt makes me a better person for myself, which makes me a better person for other people.
Yep. So, well, guilt and shame are the key ingredients to conditioning, right?
Absolutely.
Yeah, it's a negative conditioning.
Guilt and shame do not make you a better person. They make you a better person for someone else. And you can have zero guilt and shame and not be a sociopath.
Exactly.
I'm good because it feels good to be good. And I also know sometimes I need to say no and let somebody be uncomfortable so they learn to manage their own discomfort. It's not my responsibility.
Yeah. When I was in MFLAC, I had one of my coworkers agreed to go do these briefings every week or whatever. And I had already agreed to do groups where I was at working with kids. And she's like, well, you need to do it. I'm like, I did not agree to it. You did. And you volunteered me for something that I didn't agree to. You should have asked me first. And she's like, but I already agreed. You have to do this. And I'm like, I'm sorry, I'm not going to do this. I said, this is something that you agreed on with other people and not me. And I cannot make this work. And oh my God, they iced me out. They iced me out and made me feel like shit. But I had already given a commitment to something else that I could not, I wasn't going to let, I wasn't going to change my word. I'm like, maybe if you change the time, maybe if you did this, but you did not ask me first.
Right.
And I stuck to my guns, but holy shit, they used guilt and shame to try to like get me to like do what they wanted me to do. And I refused to do it. But the flip side of that is that you feel very isolated.
Yeah.
When you march to the beat of your own drummer and you do your, stick to your guns, that isolation is a real thing and it can make you feel like shit.
Absolutely.
Yeah.
Well, so I think this was a great discussion today. We'll keep, of course, always talking about systems therapy as the unfiltered family therapist. That's our goal. But keep tuning in and we'll keep giving you more inside understanding of family therapy and how it can help and how it's different than typical mental health treatments.
And I also want to remind people that this is hope. We're giving you hope that all the conditioning, all the things can be broken and you can live the life that you've always wanted. Instead of feeling like a zombie going through the motions, you can actually live your truth and be who you want to be.
Design your life.
But you're going to have to go. Yeah, you're going to have to go through that. I call it the hula hoop of fire. It's just because it's uncomfortable to go through it. If you go around it, nothing changes.
Learning how to deal with your discomfort makes it less uncomfortable because it becomes your new normal.
Yeah, but you have to feel the heat. You have to feel the discomfort in order to be different on the other side of that.
Can't change a neural network if you don't use it.
Yes. All we're doing is changing those neural networks.
Yep. Exactly. Cool. Yeah. We'll see you guys next time.
Bye, guys. Have a great week.